TOA community, what's up, everybody? Welcome back to the channel. My name is Robert Linkle with trainingtheolderadult.com. Hope you're all doing well. I want to talk to you today about a new article that just popped up here from Silver Sneakers, October 24th, 2022, about knee pain. Now, this will be a quick one. Just want to kind of review this with you and discuss it. I know a lot of people out there suffering with knee pain. If you enjoy this quick review and you feel like this information is valuable, please share it out. Please hit the subscribe button and ring that bell and make sure you don't miss any of the content that we put out. I appreciate any and all of your support to help us grow our channel. All right, gang, let's talk about this a little bit. Now, first thing that kind of comes into this is what is knee pain and what are we looking at here? The typical knee pains are swelling, stiffness, weakness in and around your knee, popping and or crunching noises when you bend your knees, and then your inability to fully straighten your knees out. So you will feel sharp, stinging, piercing pains. You'll have dull, achy, kind of constant pain. You can have that inability to fully extend or get a really deep flexion or a range of motion out of the knee. There is that crepitus, like popping and crunching feel every time you move the joint. You'll feel that over and over with every step. You'll hear it as you go. A lot of the times, as you, if you're stagnant, you're seated or you're laying down or whatnot, and you get up, it's stiffer and tighter. And as you move it and start to loosen it up, it will feel better. These are all signs of either acute, really short-term, little piercing injuries, something like that that's happened for a short period of time, 2-3 weeks, maybe 4 weeks at the most, and then starts to improve, or chronic. Now we're technically kind of talking more about the chronic knee pain in this case, meaning you've had it for 4 to 6 plus weeks or more, even all the way into years and or decades. Now there's going to be all kinds of different treatments and things. We'll talk about that here in a minute, but let's talk about what the cause of these knee injuries and knee pains really are. First thing to think about are genetics. Are there genetic transitions in our system from a parent to a child that will leave us predisposed or be more susceptible to certain limitations and or diseases? Yes. In the case of joints and lower back has, what's the word I'm looking for? Disc degeneration. That is one that there is research to kind of go both ways on. Is this a hereditary lower back injury that, will be carried through generations? Can that carry on to weaker knees or softer ligaments or less tense tendons? As far as the body's structure and buildup in that fashion, there's not a ton of research either way to really sway an answer. But when you're looking at heart disease or Parkinson's or any of those are definitely more genetic based diseases that you can kind of track through a tree line. But to say like, both my parents had bad lower back, so I'm more than likely going to have a bad lower back, there's not enough evidence or research to really support that I've seen either way to say 100% or no. I know that if your family has a history of these, you're probably more prone to weaker bone structures or weaker ligaments, something along those lines that would then lead to these injuries. And the more common ones are knee pain, lower back and or hip pain, and shoulder pain. So if those are things that you've had in your family's history, I would say be aware to it, but know that it doesn't mean you're destined to have this necessarily, okay? The biggest cause of it, we're looking at genetics first, kind of being like a predisposition to vulnerabilities. Then what's the next thing? What are we physically doing to our bodies to encourage these? Wear and tear is almost always the number one cause of this. I played football and I've ridden bikes for 15 years, or I hike and I climb, or I do jujitsu, or I throw the discus or the shot put. I do a lot of plyometrics. I run, I play tennis. All these things are heavy, high impact, cutting, changing directions. They're really, really difficult on the ankles, the knees, the hips, and the back. And so that wear and tear, whichever one you're going to abuse more, if you're very strong in your glutes and strong in your lower back, and that's stronger than your knees, where's the weakest link? The knees are going to be kind of that target. So wear and tear is a very big one, okay? Other indicators that you're having some knee pain is you're unable to put weight on your knee or be able to actually physically touch it, palpate it, push on it. It'll feel unstable. It'll feel like it'll just give out, on occasion. It's a very funny commercial out there right now where they're talking about aging and they're like, how your knee just kind of sporadically gives out and the guy's just walking and he's like, and he buckles and he kind of shakes his knee. Like, that's pretty common. That does happen to a lot of people. If you're unable to fully extend or flex your knee, and then if you have fever, swelling, or redness, and that means you have an infection, like something's really bad with your injury. So go to the emergency room. That one's super important. But listen to your healthcare providers. These things that nag and start to bother you. Let's just stick with the knee as an example. You're playing tennis, you get done, your knee's a little achy. The next day it's a little worse. By the third day, it's really worse. It's starting to get swollen. You're kind of thinking about it all the time now. Something's been done. Now, if you're icing, you're taking, if you're able to, anti-inflammatories or your, Tylenols, pain meds, whatever it is, and you go a couple of days or a week or two and you're still not really seeing any improvement, then it's probably after 3 to 7 days, if there's no improvement, life is tolerable, but you were definitely dealing with this. It's probably time to go, see somebody and figure out what's going on. Was there a tear? Was there something less severe? Was there a break or something more severe? Who knows, right? So go get checked out is the point. Start with your regular, care doctor, and then from there they could send you off to see specialists. And once they kind of get you in there, they'll do an X-ray, they'll do an MRI, magnetic resonance imaging. Geez, struggle with that one. MRI, CAT scan, I won't even mess with that one. Arthroscopy, that's where they're going to do a little incision and stick a camera in there and take a look through that. And then they'll go through different bone scans and or eventually open you up and see what the deal is. Doctors will have different areas of expertise for different knee injuries as well. Do your research if you get to the point where surgery or some type of medical intervention, as we'll say, is going to be deemed necessary. Do your research on doctors in your area. Reference friends, family, colleagues. I've even had people that they'll send out emails to their entire network of people that are connected in their life and say, considering having knee surgery, have any of you had knee surgery in the greater Sacramento area or wherever you live at, and say, who did you go to? What were the results? This and that. If you get the same name, like a very good example in our area here, we have 4 doctors that are really well known for being great with hinge joints, meaning the knee, a hinge joint, and the elbow, okay? And if one of those 4 names come up, I'm like, you're in good hands. If a name comes up I've never heard before, I go do some more research, okay? You'll start to know. I know the majority of doctors that do lower back surgeries, the majority that do hips. I know a good chunk of people to where if I hear a name and I can go, okay, you're in good hands, or, not that they're bad, it just means that I haven't heard of them, or there's not a whole lot of info to find on them. You may just need to do a little more digging to find out. But you need to have confidence in the person that's going to be working with you. Very quick story, because I do want to keep this one under 10 minutes if I can. Is when I went in to have my lung taken out, the surgeon they brought in to do this, the guy was super short and just, not physically, but just short with his mentality with me. Really bad bedside manner, like just did not take the time, was hurrying me. So are we going to do this or are we not? And I'm like, I have more questions, man. And my wife, and he's like, well, we had to talk to your wife. Why isn't she in here too? And like just really rude. And so he could have been the best in the world. I'm like, you're kind of an asshole. Like I don't trust you because of that interaction. I'm going to go find somebody else. So I went out and I found Dr. Jeffrey Moore, which is the gentleman I selected to do my surgery, who had done, 10,000 of these in the past and was definitely the right candidate. Had I just gone with the first guy because he was the first one assigned to me, I wouldn't have found, in my opinion, the person that was right for the job that I felt really good with, who had this great bedside manner, but also had way more experience. I would have just gone with the guy. And I'm all for, giving you a chance to, earn your stripes and do that, just not on my body. Not that I want to pass them on to somebody else, but I encourage you, do your research, okay? Make sure that person that's working on you, they're legit. And if they're in that process of learning, who's mentoring them? Who's working with them to make sure that you're getting the best care that you can across the professional field, if you will. Okay, and then other things, they have topical gels, creams that reduce inflammation. There's pain relievers and ibuprofen and Tylenols, ice packs, All these things are great in short-term use, long-term use. Medications and long-term regular routines of this can get detrimental. They can start to cause liver and kidney damage and start to hurt your stomach if you're taking too many of them, and actually like start to tear down the liners in your belly and your digestive tract. So careful with that kind of stuff. Compression bandages are great if you are moving. If you are stagnant, like sleeping or sitting down, you don't want it wrapped super tight. But compression is a very good thing to have on there. That's why when you see a football player roll their ankle, they get them off the field, they keep their shoe on because the shoe's already tight, and they tape around the shoe and make it even tighter, because that presses compression around the joint. And then as they continue to move it, it actually helps circulation and like pump the swelling out of that joint. It won't be as bad when the shoe comes off. If you take that shoe off, it's going to swell up immediately. So same with the knee. Like when you're going to be active, give it some support, some compression sleeves, even the ones that just slide up. There's warmth and there's compression to that. Very good. Injections, you can get, cortisone, steroids, any of these other kinds of things. They do work, and what I mean by is they reduce pain. However, on the flip side, as soon as you go from having pain every time you bend your knee to not, what do you want to do with it? You're like, well, I don't feel pain anymore. I want to use it. So you're back to golf. You're back to playing tennis. I'm going over my 10-minute limit, but anyhow, hopefully this is good stuff for you. You're now kind of blind to the fact that your knee injury is there because they've masked that pain. They didn't fix it. They've just masked the pain. And so you're like, well, I think I'm good to use it for a while. So for the next 3 months, you keep doing all your stuff. You've caused more damage, and steroids themselves, majority of them when injected into the joint, can start to wear away at the joint itself. Really, these injections are used as a gap filler between the time that you are diagnosed with this injury to the time where you have surgery to fix it. It's like, how do I get through that 3-month period or whatnot, however long it is? I've got a wedding coming up. I don't want to have surgery, this and that. Let's push it 6 months. Well, how do you get through 6 months? You do these shots, okay? Because on the other end of it, you're going to get your knee fixed. So if, having a little wear and tear from having some injections in there is worth it to keep you comfortable, then do it. But if you're just like, well, I'll just keep taking shots for the rest of my life, and you're 40 years old, you're going to wear these out really bad. And having that much, you can only have so many of these, per year, like 3 to 4 of them a year. One every quarter is kind of typical. That might even be pushing it. Sometimes it's just 3 a year. And then all your other options that are, we'll call non-traditional: cupping, scraping, acupuncture, acupressure, soaking, salt bath. I don't know. There's a bunch of them out there. These are all strategies that cupping works great, scraping works great, massage therapy, etc. Those are all things that worked for me. That's why I now went and learned how to do those and implement those and practice those with my clients the last 5-6 years, because I had it done to my hips, and they bought me time with my hips until I needed to have surgery. But again, how long will that work? Can it fix you? Yes, but if the injury is not too severe, it's just an acute injury, then it can help you get over the hump. If not, we're going to have to look at some long-term solutions, and typically that usually means a surgical intervention. Some of the knee surgeries are really, minimal, and they will have 1 to 2 weeks of rehab to have a minimally invasive meniscus repair. And then others are the unhappy triad: is your ACL, your MCL, and your medial meniscus, and all 3 of them are torn. That's like a 9 to 18 month rehab. I mean, that's significant. So just depends on the severity of the injury and what you have going on. And I don't care how many cupping sessions and scraping sessions and acupuncture sessions you do with a torn ACL, nothing's going to fix that without surgery. And that's what you've got to look at. And people go, I really don't want to have surgery. Well, in that case, a little more than a quarter, I mean, the ACL is pretty significant for your knee. Quarter of the stability of your knee is no longer intact. How long do you think this thing's going to stay together? And if you're like, well, there's people out there that go on living without one of these ligaments attached. Well, the other 3 are now doing 33% of the workload, and they were only designed to do 25% of the workload. So what's the chances of one of those 3 becoming injured? Because they're all overloaded now, pretty high. So you got to be smart when it comes to it, is my point. My 10-minute goal turned into 15, but I hope you enjoyed this. Any comments, questions, hit me up down below. I appreciate you. Much love to all of you. If you have Any needs, head over to traintheolderadult.com. Please subscribe, please follow, please share. Help us grow our community. Thank you, everybody. We'll see you in the next one. Take care.